Welcome to an Internet Town Hall with State Senator Dr. Ed Hernandez. Tonight's topic, California and the Affordable Care Act. Now, live from Sacramento, here's tonight's moderator, Brian Green.
Hello, everyone. Well, it has been announced and denounced in television ads and speeches across the country, with stories about socialized medicine and death panels and the federalizing of the nation's healthcare system. And last month, the House of Representatives voted to repeal it, again, for the 37th time. But the Patient Protection and Affordable Care Act, or Obamacare, as we all know it on the street, is law now. It has survived a U.S. Supreme Court constitutionality test. And indeed, few government initiatives reach so many corners of American economy and society. And the next big challenge, then, facing the Affordable Care Act is carrying it out, pushing reluctant states to set up insurance marketplaces and expand on Medicaid, keeping an eye on insurance company rates, measuring the law's effect on small business hiring. And then there's California, where more than a dozen companies will compete for the business of more than 5 million people expected to purchase policies through the new exchange set up by Covered California. That's the hub for the new insurance marketplace here in this state. President Obama has already praised California as it prepares to implement the ACA come 2014, and believe it or not, there are a lot of people who have pinned their health hopes and their health fate to this new healthcare reform plan, particularly those who have been denied health coverage or simply can't afford it. So how will the Affordable Health Care Act affect us here in California? What impact will it have on employers and workers and non-English speakers and young people who know they will live forever and don't need it? And what will happen if, in the end, Obamacare really works? Oh my gosh. Well, we will attempt to answer those questions in this hour and also walk through the implementation of the Affordable Care Act and what it means for you, and take your questions too. Joining us here is the California lawmaker who is shepherding California through the birth pangs of the Affordable Care Act. He is State Senator Dr. Ed Hernandez of the 24th Senate District, including West Covina and cities all the way from the east side of LA to East San Gabriel Valley. He is also a practicing optometrist and chair of the Senate Health Committee. And you are indeed one of the key folks that us here in Sacramento and at the state capitol turn to understand and to figure out how to implement the Affordable Care Act. Welcome, Senator. It is great to have you here.
Well, thank you very much for the invitation. It is a pleasure to be here, and this is one of those subjects that I absolutely love talking about. And when I was articulating the Medicaid expansion on the floor just last week, right when we were doing our budget, when I got up, I said, this is the reason why I ran for office, was number one, to make sure that everybody, not only in this country, but particularly in the state of California, has access to health care.
That's great. And I know you still have your work cut out for you as the one who helps us guide through this and through the open enrollment process through this next year. And folks, we do want your input into this program. We do have a lot of emails that have come in the last couple of weeks since this program was announced. But if you're watching here this program right now live and you have a particular question that you would like to submit into the program, a particular thought or notion that you want discussed, just to the right of the screen is a little prompt to put your name, your location, and write in the question. Just type it on in, hit submit, press, and we'll do our best to get to as many questions as we can before this program ends in the next hour or so. So we look forward to your participation as well through your emails. Well, Senator, I guess whether you hope for it or dread it, depending on how you look at it here in California and the nation, we are really at the precipice of something extraordinary and fascinating, are we not?
I agree. And I can't overstate, and you made some comments in your introduction, this act and this law that was signed in by President Obama is the absolute, I can't stress enough, the absolute most important piece of healthcare legislation that this country has seen since the Johnson administration. And during that period of time, we dealt with two segments of the population. Those who didn't have the sources like Medi-Cal or the poor, and then of course the elderly, which are a very important segment of the population. Mm-hmm. But we left this huge vacuum of individuals in the middle who didn't have access. And keep in mind that the United States of America is the only industrialized country in the world that doesn't offer or didn't offer up until this point. So we have made dramatic steps. This is a big thing. And you also mentioned the Supreme Court, and it is a very, very contentious piece of legislation, and it's still politically charged. However, the bottom line, the Supreme Court held that it's constitutional, albeit a tax, And each state has the option of expanding their Medicaid, which California is going to do that.
It's hard to believe it's been a year since that Supreme Court ruling came out and all the concerns about what would happen, but it did. The court did rule in a majority vote that it was constitutional and would work in a commerce kind of way. So it has been an interesting year or two since this came out, and now it's gone from the pundits in the Beltway now to the states and to the consumers, and obviously that affects us here in California.
Very, very much so, but here's what I really believe, because it is still politically charged. You have some states that are going to choose not to expand Medicaid. You have some states that are choosing not to open an exchange, therefore the federal government will be opening one for them. I really believe California is way ahead of the entire country, and I believe that the success of the Affordable Care Act in this country is going to be based on the success of the Affordable Care Act and its implementation here in California. And we're prepared, we're going to do it, we're going to move forward, and we're going to take a leadership role.
Well, President Obama, as I said there at the opening, has praised California for what we have done so far. And Peter Kelly, as I believe his name is.
Peter Lee.
Peter Lee, I'm sorry, yes, is the head of Covered California. Are you pleased with this so far, the way this is rolled out, this rolling, preparing to roll?
Very, very much so. As I mentioned, California is the first to have an exchange. We are way ahead. Last year, the governor signed my bill for the 10 essential health benefits. Right now, California is the only state that has defined habilitative and rehabilitative services. We are prepared. There are, I believe, 13 insurance plans that are ready to do business. Some of the premiums that are already projected are much lower than we ever expected, and you will never be denied coverage of health care, especially now that the governor has signed into law all the consumer protections that the state of California will allow individuals to get health insurance.
And indeed, he did go into a special session to allow legislation to expedite and be fast-tracked that helps put us in a better place for this next year.
Yeah, and the 3 bills that are in special session is the one I mentioned, which was all 3 of my bills. One was the consumer protections that signed into law. Last week, we put in front of his desk the Medicaid expansion. I anticipate he'll sign that as well, which will allow individuals up to 38% of poverty level to get free access to care. And then of course the final one that we're still running through the legislature is what's called the Bridge program. Those are for individuals who are just outside of the 138% of poverty level, where we're going to get a little bit better break on their premiums, and also they don't have to worry about moving from their Medi-Cal plan into the private plan so that they can keep their same doctors.
Can California afford this? We are still fresh off a really tough economic time, and even though California is pretty familiar with this, and this isn't uncharted territory for us, in some ways it is, especially with the federal government's intervention. Can we ultimately afford this?
Yes, we can, and here's the reason why. Because we currently participate in what's called Medi-Cal, and it's a 50-50 match. So 50% is paid by the federal government, 50% paid by the state of California, and we've always done that. The Medicaid expansion, up to 138%, that is 100% funded by the federal government up to the year 2020 and drops to 95%. So the money will be there. But the more important part, the exchange portion, the part that people are going to be buying into, the money that's going to subsidize their health insurance comes from the federal government, not from the state of California. We just need to make sure we're good stewards. More importantly, that we negotiate good, low rates and make sure everyone has access. We implement it, and we will just roll forward.
Right. Well, let's get into the weeds here, if you will, a little bit, because a lot of people are asking, what does implementation of the Affordable Care Act mean in California? So let's talk about that. Signing up and enrolling. Obviously, Covered California will be our source for this, our hub for this. Open enrollment starts this fall, is that correct? Tell us a little bit about
this
that.
coming October, I think it's the 1st, and it goes until the following March of next year. That's called the open enrollment period. Covered California has an incredible website. I've been going on it periodically. They have this really, really cool, it's called a calculator. You just punch in your age, your income, number of dependents you have, and it'll kind of put out the answers for you and tell you what you're eligible for, the subsidy, what the cost, and then the different premiums that are going to be available. It is pretty soon, I'm going to guess within the next couple months, you're going to see a significant amount of marketing from Covered California, which you're going to see PSAs, television ads. You're going to see community groups that are going to get grants, everything from promotoras to church groups to nonprofits. you know, there's going to be this extensive marketing to the consumers of what's available.
Now, I mentioned, and you reassured us, that California indeed can afford this. There are folks out there who are concerned themselves whether they can afford this. There are folks out there who say, I don't want coverage, wondering what their employers are going to do. But let's talk in particular about those folks that are worried about whether or not they can afford it. And even though we do actually have some emails from viewers that we want to take here in a little bit, we actually have some video questions, including our first one here from a lady named Betty. She's retired. She's a senior citizen. And she's got a pretty basic question about affording the Affordable Health Care Act.
Hi, my name is Betty Valles. I am 85 years old, and I am concerned about the Obamacare program. I am on Medicare, and I would like to know how is it going to affect me and also the rest of my friends.
Thank you for that question, Betty. Key question. Yes. She's on Medicare, and obviously you've given us some reassuring words here on this so far, but what is that going to mean to somebody like Betty and her family?
Well, everybody and anybody who currently has health insurance can keep the plan that they have if they have it and they're happy. But more importantly, individuals on Medicare are not affected because once you turn 65, you move into the federal government and the Medicare system and you keep those coverages. One of the advantages, though, now that the Affordable Care Act has been signed into law, individuals on Medicare actually get better benefits because of it. They get free services, for example, for preventative services. So there are better benefits within the Medicare system. But let's say, for an example, you have a job, that you have insurance through your job. If you choose not to go through the exchange, you keep that insurance. If you have a grandfathered plan that you've already purchased the insurance and it's just as inexpensive or even less in the covered California, you keep it. You're not forced to leave the plan that you currently have if you're happy with it.
That's good to know, reassuring. You have actually, in some of your attempts to break this down, you have sort of an example of what a family of four would be facing. And I think we've got some notes here too. But tell us what that means. What would this mean to a family of four and looking for health care that they may or may not already have under the Affordable Health Care Act?
Well, I think the absolute most important question to ask that family is how much money you make. And if you don't have or have never had health insurance before. And keep in mind, but before I answer that, the most important thing is you will never be denied from here on out coverage. Whether you have a pre-existing condition, you've had some serious health problems, because the laws are now written that there's no discrimination. So let's say you, a family of four, are below 138% of poverty level. Everyone in your family is covered through the state of California through what's called Medicaid or Medi-Cal. And then if you earn between 138% of poverty level up to 400% of poverty level, you will get subsidies to help offset the cost of that health insurance. Now, if you make over 400% of poverty level, and keep in mind that that number is about $94,000 a year. So if you make over $94,000 a year, you don't get any help. But if you make below $94,000 a year, and for a family of four, if it's $32,000 a year, you will get some type of help that'll offset the cost of those premiums for you. And if you're below 250% of poverty level, you'll actually get help to cover your co-pays, your deductibles. There is plenty of help available for you to help, and it'll be very affordable.
And I know that Covered California has already done a great job in sort of breaking this down for the different type of health plans. They've kind of gone Olympic on us with the bronze, silver, and the gold and platinum. Tell us a little bit about that. Walk us through that.
Well, okay, that same family of four. Let's say they make $55,000 a year. That means they're eligible for a subsidy. And the premium for that family, and I'm just going to pick a number, let's say it's $450 a month. But they get a subsidy, which means that the federal government will pay about 25, 30, 40% of that. So that means they don't pay the full amount. Okay, so they get to choose amongst various plans, and these are called the premium plans all the way to the bronze plan. So let's say you're a family and you realize that you don't want to spend a lot of out-of-pocket expenses, but most, if not all, of your family members are healthy. you don't use a doctor a lot. So you're going to buy the cheaper plan because you know you're going to utilize the system less, okay? But let's say you're a family that goes to the doctor a lot. Let's say your children have asthma, you have high blood pressure, your wife has diabetes. You're going to be going a lot, so you want to have less out of pocket, so you want to get the more expensive plan, so you're going to pay a little bit more premium, but the coverage is going to cover more of your cost of that insurance. So you have an option within what you're going to be allowed to buy of paying a little bit more and having a little out of pocket, less out of pocket, or paying a little less, and then when you utilize the system, you pay more out of pocket.
So it's not cookie cutter. You can decide what kind of plan is best for your family.
Pick and choose based on your own personal circumstances, how much you want to budget for it, and how much you think you're going to use your insurance.
You have a list of what I think are 10 categories that are included in the basic health plan.
Yes.
What are they?
Well, keep in mind that prior to 2014, or prior to the signing of the Affordable Care Act, at one point there was what was called junk insurance sold. So somebody can be misled and said, we'll sell you this health insurance, and it's very inexpensive, and you have a very, very high deductible. Okay, well, God forbid you get a very serious disease, you get sick, and then it reaches a certain limit, and then after that you have to pay for it. And that's what the number one reason why the people go into bankruptcy in this country. Well, what we've done is we've set a floor or a minimum of what is going to be covered, and those are called the 10 essential health benefits. So I don't care who you are, whether you're young, middle-aged, or an older person right before you go into Medicare, everyone is going to be buying the exact same product, and all of these 10 essential health benefits are. And they are from the 10, it's ambulatory patient services, it's going to be emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory, blood tests, preventative and wellness service and chronic disease management, very important if you have diabetes or high blood pressure, and oral and vision care for children. So these are things that everybody's going to have within their plan. And you'll be comparing, one plan. The only difference is the cost for the different precious metals, but everyone will be getting all these services.
Well, you mentioned the marketplace, what we're calling this is a healthcare marketplace. Which companies are actually going to be offering policies?
Well, Covered California did an incredible job. They put out bids to the various healthcare industry, and they negotiated some very, very reasonable rates. And there's some of the biggest names from, and I've got it here, I just want to double check because I want to make sure I don't get it wrong. But we've got a lot of anywhere from LA Care to Molina Care. We've got Sharp, we've got Blue Shield of California, Kaiser Permanente, you've got HealthNet, you've got Valley Health Plan, we've got Blue Cross of California. All of the big plans are going to be participating, so I don't want the consumers to think that they're going to be, skinny plans, they're going to be, smaller groups. Some of the largest health plans in the country are participating because they understand the importance, but more importantly, they want to be in the exchange to get business.
There's been some concern that has come out in the last couple of months as these different plans have signed up and get ready into the marketplace that, in fact, some of them might try to jack their prices up a little bit because they want to discourage the needy consumers, the folks that don't have the care. They don't necessarily want that extra Medi-Cal patient work. Is that true? Have you heard any of that?
Well, keep in mind there's two books of business. You have what's called Medi-Cal, and then you have Covered California, or the private pay, or the exchange. And within the exchange, the prices are going to be set based on the number of people buying the policies, and keep in mind that the cost of providing that care is based on the cost of that care itself. So if you have a lot of sick people in that population, the prices unfortunately are going to go up. So the key to success is getting many individuals in to spread the risk. But with regard to Medi-Cal, there is still going to be a lot of plans that are, especially within the counties, the two-plan health system, for example, in Los Angeles, where those provider groups are going to want to go in and see those patients.
Like Molina, for example, right? They can be competitors in this, right?
They definitely can. They're going to be part of it. But here's where a lot of that segment of the population is going to get care is the community clinics, the federally qualified health centers, the providers that are already seeing that population in those particular communities as well.
Now, one of the things you mentioned here about the fact encouraging as many people as possible to take part in this, there is this group of people out there, the young people of California. They say, the working young people, or even those that don't have jobs but need health care. We, in fact, actually have a video question from a young man named Mario. He is a student in his 20s. He actually is still living with his family and covered by his parents' insurance, but he's got a question related to this.
Hi, my name is Mario. I'm 24 years old, and I'm a college student, and I'm just wondering, I've been hearing about the Affordable Care Act, Obamacare, and covered California, and I'm wondering, what does it all mean, and what does it mean for me?
That's the key question right there. Thank you, Mario. What does it mean for him? Is it, do they face higher prices, the young people, just because they're not used to having this much insurance?
Well, let me first answer, what does it mean to me? And that question is asked by everybody, whether it's a senior, you're middle age, you're pre-Medicare, or if you're young. This particular individual, several options. If they are under 26, still under their parents' insurance, they can stay within their parents' insurance, no cost to them. Let's say they're independent and they're on their own and making less than 138% poverty level, it's completely covered. And I would assume most college students aren't very well off, so they're going to get coverage through Medi-Cal. But let's say it's an individual that's graduated from college, somebody who has got their first job, they're making pretty decent money and they're still within that area where they can get a subsidy. Then they're going to get some kind of help and they're going to have to purchase their insurance. But here's the key, and here's the more important thing. They have to engage and they have to buy insurance. That's the law. Everyone has to buy insurance, and if you don't, there's a penalty. And in order for this to be successful, we have to spread the risk so that we get everyone in, including the healthy individuals, because someday they're going to need it as well.
So there is that penalty, but in fact, once they enter this marketplace, they'll realize it's not quite as ominous as they might think at the beginning. All right, we've talked about the elderly, some of the folks who need health care the most, young people. Let's go to businesses. And I want to kind of separate them out, small businesses and large businesses, and what it means to them and what criteria. First, let's just talk about the small business owners. There is another video question, actually, from a gentleman named Art. He is a small business owner, which I believe is 50 employees or less. Let's hear what Art has to say.
Hi, my name is Art Ramirez, and I'm currently an employer in the San Gabriel Valley. I've been in business for over 30 years, and I currently have 27 employees. I offer them health care now, and I'm just wondering how the new Covered California plan is going to help my business.
Thank you very much for that question. How will that help his business? And does he, as an employer, have an option to provide health care for his clients?
Well, first of all, let me thank Art for providing health insurance to his employees. Very few small businesses do, so he is a good actor and he's doing all the right things. But because he has less than 50 employees, he has a choice. He can either offer it or not offer it. He will not be penalized for not offering it, and I hope he continues to. But let's say because he wants to be competitive, he wants to make sure he maintains his employees, and that's why he's offering it. Now, through Covered California, through the SHOP program, that he can actually get subsidies to help him offset those costs for what he's already doing to help him with those employees that he's paying.
And SHOP, that's the Small Business Health Options Program, to separate the acronym?
Yes,
okay, good.
And that'll help him, and so by what he's doing, he'll actually get help and get subsidies to help him offset the premiums that he's already paying.
Great. Well, let's go to the large business owner, I guess. I don't know how many of those. Actually, there's probably more of those in the state than there might be the small businesses, but each one has their own distinct needs and questions. Yesenia is a large business owner, as we can call her, and she's got a question about this.
Hi, my name is Yesenia Harris. I own a clothing boutique. I've now been in business for a little under 7 years, and I have a question. I want to know how Cover California is going to affect businesses that have 51 employees and more.
There you go.
Good question. If you have more than 50 employees, you will be required to purchase health insurance for your employees. There's several options. You could buy it on your own in the open market, you can buy it through Covered California, or you can self-insure. And if you self-insure, you get what's called stop loss to help cover the difference if you want to take that risk. But here's what I hope businesses don't do. I hope they, and keep in mind, this is 50 employees at 30 hours more per week. So if you have, let's say, 30 employees that are 40 hours and 20 that are under 30 hours, you don't have to buy health insurance for those employees. But what I hope doesn't happen, that those employers drop people's hours to get under that 50 limit, because we want to get as many people insured as we possibly can.
That is a concern, that businesses are going to go off the reservation, so to speak, and start putting full-time employees on a part-time basis, that kind of thing. So that really has to be looked at.
Yeah, and I know that, but I really believe that at the end of the day, businesses are going to do the right thing. Like the gentleman we heard earlier, he has below 50, but why is he doing it? For a lot of reasons. I think businesses, to be competitive, want to offer, other benefits, whether it's health insurance, whether it's their retirement, longer days off, competitive salaries. And that's part of the process of trying to maintain the best quality employees that you possibly can. And I think everyone is going to do the right thing at the end of the day.
Finally here, another subsect of this, another element of this, are those that have several businesses. Right. There's a gentleman named Charlie who has a question. He indeed has several businesses and has something to ask about what's called common ownership.
Okay.
My name is Charlie Klanakis. I'm a contractor, and I have several businesses. This particular business, I have approximately 80 employees. I have other businesses that have 3 to 4, some have 10, and I own all the businesses. The question is, do all my businesses get combined for total employees for the new healthcare, or do they get kept separate and each business is treated differently? That's my question.
Thank you for that question, Charlie. And I can imagine how complicated this must be for a business owner like Charlie that's got a really full plate in terms of employees and businesses.
Right. Well, good question. And the answer to what's called common ownership, if there's a combined net of total number of employees amongst all your businesses, they're added up. So in Charlie's case, he may have 80, thinking he has to pay only for the 80, but he doesn't have to pay for the other businesses that have 10 or 8 or whatever. But you have to combine them all, so therefore he will have to provide insurance for all of them.
Well, we're going to take some emails here just in a couple of moments from some of our viewers that have submitted them before they joined in, or even sometime just there in the last half hour. And we do encourage you, as we're having this conversation, if you want to participate, we would be more than happy to have you do it. Just to the right of the screen, there's the prompt for you to put your name in, your location, where you're viewing this from. Type in your question, hit submit, and we will definitely get to your question. Let me ask you a quick question, though, as we talk about where California stands in contrast with the rest of the country and even the rest of the world in terms of what is available from the insurance companies. Californians do have a lot of options, and we're really lucky versus a state like, say, Maine, that really only has a couple, right?
Yeah, I mean, California, as I mentioned earlier in the program, is way ahead of the rest of the country. We are doing an incredible job with the exchange. All of the insurance companies want to do business here. As I said, we're one of the first to have an exchange where we've already determined what habilitative, rehabilitative are. I really believe we're going to move forward and set the gold standard for the entire country.
And again, when we talk about federal bureaucracy and federal health care and socialized medicine and all that, really America, here in and California as well, we really don't have it quite as technical as other countries do, correct?
Well, here's what's unique about the system we have in this country. And the bottom line is we still have a for-profit system, and I think that's just how this country wants us to move forward with health care. But if a state chooses not to have an exchange, then the federal government will set it up for them. We chose to have one, so that means we're in charge of our own destiny and we're implementing it, so we'll move forward. States can choose not to expand Medi-Cal or Medicaid. We chose to because California believes that that's an important issue. We're going to move forward. Other states won't. The nice thing about us taking and expanding Medicaid is we'll get more money from the federal government. What more money means to California is more jobs. We're going to need more nurses, more doctors, more individuals are going to be getting care. That money, those are billions of dollars going into our economy that are going to generate, as far as tax revenues, income tax, state tax. It's going to feed back in and increase the economy itself. So I really believe California is in charge of its own destiny.
Great. We are talking about California's implementation of the Affordable Health Care Act, and our guest is State Senator Dr. Ed Hernandez. He is the chair of the Senate Health Committee. And we're going to go right to the email questions. I've been derelict in my duty in getting to some of these, but I wanted to walk through all the implementation process. We have a question from Gloria from Whittier, and she asks about the undocumented residents here in our state. Will they have an opportunity to buy insurance?
Well, unfortunately they don't, and at the federal level this law states that you have to be a United States citizen to be able to get to purchase, but more importantly to qualify for subsidies or to get help through the exchange. However, in the state of California we have a system that we have to keep in mind that there will be some individuals that won't get insurance. Those are individuals who are eligible but choose not to sign up, individuals that are eligible for Medicaid that just don't sign up, and the undocumented. So these are what we call the uninsured. There's going to be still a large population of uninsured. Well, we have in our county systems what's called a safety net system. And those county systems are designed for people who fall through the cracks. And those individuals will be seen in our county system as a last resort, because we want to make sure that everyone has some type of availability to health care.
Let's talk broader, in some ways, about the non-English speaking residents here in California and some concerns that have been brought up about how they are affected by some of the advertising, about some of the pitches for these health insurance companies and the buy-ins on this. Are we concerned about that going forward?
No. Well, I mean, obviously, anytime there's new business in the state, there's always going to be somebody that's going to want to try to fraudulently sell something. But here's what's great about Cover California, but more importantly about the implementation of the Affordable Care Act, that the only way you can get a subsidy is if you buy it through the exchange. You still can buy your insurance outside, but whether you buy it in the exchange or you buy it outside, the products have to be the same. So you're comparing apples to apples. But what Covered California is going to do is when they start marketing, they're going to market in multiple languages: Spanish, Chinese, Filipino, I mean, you name it. So there'll be a significant amount of marketing in various communities, but more importantly, community nonprofits will also be helping out to be able to market to their particular ethnic group, whether it's in Spanish radio or Spanish language or Korean. So it will be available in all languages.
All right. Our next question is from Johnny from Walnut. He asked a couple of questions, actually. What will be the different health plans, the programs offered, and what will be the cost? I mean, we've obviously got into this discussion, too. Will this be by age groups, distinction by occupation, place of residence? When will the full detail of information be released? I'm giving you quite a cornucopia of questions here. And what will happen to all current programs and those subscribers paying the current health plans?
Right. Well, like I said, if you have a plan right now and you're happy with it, you keep it. There's no discrimination, nothing on age. There's no discrimination on your job. Everyone will get health insurance and no one will be denied. Real simple answer to that question is it all depends on your income. If you have an income below 138% of poverty level at whatever it's single or multiple people in your family, it's completely covered. And from 130 to 38 to 400%, there's some kind of subsidy help from the government to help pay for it and offset the cost.
Great. Glenna from Fresno has a question. She says, is there a website for consumers explaining the many components of the Affordable Care Act, and how does one go about comparing various health insurance plans to get the quality coverage for the cost? And I know the answer right away on that, an easy one.
Yeah, very, very easy, and it is very simple to use. It's called coveredcalifornia.com, and you just go online, and it's got it's got this, like I said, a really, really cool calculator. Once it calculates what your costs are and your subsidies, then it even goes a step further, and it'll show you the breakdown of the different plans and what that out-of-pocket cost is going to be for you.
Great. Mary from Sacramento asks, will there be insufficient medical services available to meet the demand when the Affordable Health Care Act is fully implemented? Now, I guess that question can go either way. Right. Will the services be sufficient, or is there concern that they won't be sufficient?
Well, I mean, that's one of the debates that we're talking about in the legislature right now, because there will be some areas where there's going to be a distribution problem of providers, because we're going to have 4.5 to 5 million new Californians that are going to be having now in the system. And if you think about it, very soon the baby boomers are going to be needing these services. We as policymakers have to make sure that if we're going to be mandating that you purchase health insurance, we have to make sure that you see somebody. So currently I'm running some bills through the legislature to address that, to look at all of the provider groups, to utilize them in the absolute most efficient way to make sure that every consumer gets safe, affordable, but more importantly, access to health care at the appropriate time.
Great. Mark from Wairika, his question, he says, is one of fiscal and logistical simplicity. Why did we not just change Medicare and Medi-Cal to have a purchase option similar to the free and reduced lunch program? A sliding income scale could be adopted, and folks could contribute to the program to receive coverage.
That's one mechanism for us to do it. I mean, there's also been the single payer mechanism. There's also been Medicare for all. But as the comments you made earlier in the opening of this show, it's a very politically charged issue. And even to this day, it's still very politically charged. At the end of the day, the way we govern is based on compromise. And the hard reality, the compromise that we came up with in this country is the Affordable Care Act. Is it perfect? No. But I think it's in the right step, the right direction, and we will move forward, and I think it'll be successful. And as we move forward, we'll make changes and adjust.
We are talking to State Senator Ed Hernandez. He is the chair of the Senate Health Committee, and we are talking about the Affordable Care Act and California's implementation of the Affordable Care Act, also known to many of us as Obamacare. We really do want your questions. We have a half hour left here at least with the senator, and we've got some great questions already from folks all over the state of California. We'd love to hear from you. If there's anything we're talking about here that's prompting you to ask a question or to share a thought, well, there's a prompt for you just to the right of your screen. Put down your name, your location, where you're writing from and watching. Type in your question, hit submit, and we will get to as many as we can here in the body of the program. Our next question is from Angela from Los Angeles. She says, what will be the process for health plans to facilitate coordination and continuation of care to patients with chronic illnesses that are under the care of out-of-network providers? And will patients be informed of their rights? And what if the out-of-network providers disagree with the rate offered by the plan?
Well, first of all, anybody who wants to do business in covered California has to be licensed in one of two areas, either the California Department of Insurance, which means an insurance company, or Department of Managed Healthcare, a HMO. And no one individual doctor or anybody can sign up with Covered California. Once they met all that criteria, then they have to meet very, very strict guidelines as far as what we call network adequacy. Do they have enough doctors that provide services from A through Z? You know, all these from ambulatory to prescription to whatever. And they have very, very strict guidelines that they have to meet certain criteria, like they have to answer the phone within so many rings, they have to make an appointment after so many days, that they have to see the patient and address the concern. So the system is now set up to be able to see these individuals. These health insurance companies will sign a contract with Covered California, and then they start doing business. So let's say you pick Kaiser Permanente, means it's a closed system, so you have to go to Kaiser. If you go outside of that system, you won't be covered just like any other insurance company. However, if it's an emergency, if you get in an accident, you're in an emergency room for another system, they'll see you, they'll transfer you over to Kaiser, or if you're Blue Cross and you're out of their system, if it's an emergency, they'll transfer you in. But the bottom line is you have to stay within that network. And if you go out of it and you're not in an emergency situation, you'll have full disclosure. If you go to a doctor and they'll say, well, you're not in my network or you're out of my network, this is the cost. And if it's an elective procedure or if it's an elective exam, you can say no. And you're going to get a much better deal by staying within the network that you've signed up for. But the way they can keep the cost down is because those health plans have created networks that they have a contract with that they guarantee that what your out-of-pocket is going to be, whether it's a deductible or your co-payments.
You have said that no one will be denied care
Yes.
under this new coverage of the Affordable Health Care Act. There's also the concerns about price discrimination based on age
No.
or location, the redlining as we
Right.
call it in the auto insurance world.
Right.
You can assure us that that's not going to happen
It
either,
is
right?
not going to happen. And the reason why it's not going to happen, just this year in special session, the governor signed my bill that gives every person in the state all the rights and privileges that they're going to be afforded, like guaranteed coverage. They won't be denied because of pre-existing condition. But here's the important one, is let me give you an example of the average person that, let's say, has a job. They're 56, 57 years of age. They're pre-Medicare. In other words, they don't qualify for Medicare. This is under the old system. And that job that they work for is a job that doesn't offer health insurance. They're probably going to be priced out of the market because of a pre-existing condition in the old system. And that person, at one point, if they chose to buy health coverage, can spend as much as 18 times more than the least expensive and the healthiest person in the system. That's no longer. So there's no more discrimination because of age. There is now what's called a 3-to-1 ratio, which means that the person that's the oldest right before they get into Medicare will not spend more than 3 times the amount of the youngest and the healthiest person. There's a leveling out to spread the risk amongst everybody.
Great. Another question from Arlene from Hacienda Heights. She says, I have a $3,000 deductible on my new insurance with United Healthcare that I was forced to take as a retired teacher. I'm now paying so much for my insulin medication and my 3 kidney medicines and my 3 blood pressure medications, gout medication, Synthroid, and other pills. Will this new act help people like me? I'm paying almost $800 a month, and I'm not even 65 yet.
Right.
So prescriptions is another key element of this.
Yes, very, very much so. She didn't say how much her annual income is, but again, the biggest question is how much do you make? So if her annual income is within those ranges, she'll get subsidized help, and even with the subsidized help, even with all those conditions, it'll probably be a lot less expensive than what she's paying now. And the story hasn't been written in the paper when you're going to see dramatic decreases in costs for that exact same person. But here's the other thing too. I mentioned earlier in the show that bankruptcy in healthcare was the highest reason for bankruptcy, because people would buy insurance that wouldn't cover, a catastrophic disease, prescription medications. Well, right now, worst case scenario, no one will ever have to pay more than about $5,600 a year in their health care. No one will, because those are the maximum limits that are capped. And there is no limits as far as the coverage you're going to get. So, God forbid, worst case scenario, you get hit with a devastating disease like cancer, a brain tumor, an automobile accident. Worst case scenario, you're going to spend $5,600 a year, and everything will be covered until you are completely healed or recuperate or recover.
That has to be very reassuring
Yes.
for a lot of Californians. Roberta from West Covina has a similar type of question, but a little bit different. She says she's been unemployed for 43, and she has a, excuse me, let me make sure I get this right. She has an unemployed 43-year-old son living at home. He has no income nor assets. She is 75 years old. Her husband is 69. How is her son supposed to buy any type of insurance? We're depleting our savings, caring for ourselves and him. Now that sums up what a good part of California is dealing with right now.
Well, just the 2 individuals, which I believe, as you mentioned, are over age 65, they're covered under Medicare. The son, if he has no employment, he's a legal resident and can prove that he's not working, will probably qualify for Medi-Cal, and he also will be covered as well.
All right, we are talking to State Senator Ed Hernandez. He is the chair of the Senate Health Committee, and he really is one of the key folks that we are all going to here at the state capitol to learn more about the Affordable Health Care Act and California's implementation of it. Our next question is from Paul from Rosemead. He says, I am a health care provider, but I'm being priced out due to low reimbursement rates from Medi-Cal. What are we going to do to address this issue for providers?
You know what? I hate to say this, but in the state of California, we have some of the lowest, if not the lowest, Medi-Cal reimbursement rates through the entire country. That has to be addressed. Right now, as you know, the state of California, the economy's coming back. That is the absolute highest in our priority to increase those reimbursement rates. But let me just tell him there is some good news in the horizon, at least for the short term. Starting now, the federal government will be paying Medi-Cal reimbursement rates at 100% of Medicare for 2 years, and then we in the state of California and policymakers have to make sure that that continues after, so that we can get patients seen by providers. Because what good is it if there's not an adequate provider network?
And I know that's an issue that you've been trying to address as you've dealt with the special session legislation, is make sure there's enough Ed Hernandez's out there
Make
to
sure that
handle
there's
this.
enough doctors out there to
Yeah.
see these patients. So we will be working on it, and it is going to be a priority of the California State Legislature.
Great. We'll take another question here. This actually will be our final question as we get ready to wrap up. These questions have been terrific. This next one is from, hopefully I'm pronouncing the name right, Ruel from Los Angeles. Will ACA implementation be able to get ABA coverage for children with autism-related disorders in Medi-Cal who are not currently getting those services?
Right. Yes, to a certain extent. As you know, in the 10 essential health benefits outside of the exchange, ABA therapy is covered. In Medi-Cal, though, and we had a fight with the governor because the current ABA individuals that are covered through the system right now will be covered, but new expansion population will not. And that's one fight that we unfortunately lost. Hopefully, as the economy picks up and there's more money available, we're going to push to make sure that all children will get ABA coverage in Medi-Cal at least.
Great. Thank you very much for those questions. You mentioned earlier in that list of services that are offered as part of these plans, the nexus between mental health and physical health.
Right.
And how is that going to be dealt with in the Covered California implementation of the Affordable Health Care Act? Because it's rare when the therapist meets the physician.
Right, right. Well, I mean, as I mentioned, and here's the good news, not only in Covered California and the 10 essential health benefits that you get mental health and substance abuse, but it's also, and that's one thing that we did win in this most recent with the governor with regard to the Medicaid bill that's on his desk, is you also get mental health as well as substance abuse coverage in Medi-Cal as well. So everyone that's going to have health insurance will have those two services.
Great. There's been still some concern from the consumer watchdogs out there, despite the reassurances you've given us about the price controls and the access, that the networks are too limited, that the prices are too high. Some of them are even considering a ballot measure for November 2014, similar to what we had in the 80s with Prop 103, giving the Department of Insurance power to approve or deny these increases. Do you think we're going to come to that? Do you think that's needed? What's your response?
Right. Well, keep in mind that as politically charged as the Affordable Care Act is, it is still in a for-profit system. It is still in the United States of America, and I really believe that at the end of the day, the prices are going to be set based on the cost of doing business and also the free market. The reason why I'm opposed to rate regulation is because now that's not going to allow the free market to run its natural course. Okay, everyone has a right to introduce an initiative, but I think that if you allow the market to run its natural course, you get people in the exchange, costs will reduce. But here's what's interesting: they were predicting that Covered California wouldn't be able to come in with low rates. Yes, 13 plans signed up. I believe it's around 13. The rates that have come out in Covered California are much lower than to be expected. And as the natural market forces start working its way through, you're going to see more plans start to jump in and prices start to stabilize. Let it run its natural course. And I'm not supportive of rate regulation at this time.
What about transparency? Is there enough transparency in this process with costs and the way insurance industry is going to be doing business, the way Covered California is going to be putting together this marketplace? I know a couple of your colleagues, Senator Emerson and Senator DeSaulnier, had introduced legislation within the last month or two to ensure that transparency. Is that something you support?
Oh yeah. Keep in mind that anything we do in government or anything we do with healthcare, transparency is a huge and very, very, very important issue. But keep in mind the bill that you're talking about that Dr. Emerson introduced, that Covered California was already transparent. What they wanted to put in statute was to guarantee that it stayed that way. So they did everything, they're doing everything appropriately. But I think, and I'm going to be working on some transparency issues next year, because what we need to do is to start looking at all costs. And I'll just give you an example. Let's say that consumer out there that's watching and listening, I would guarantee that if they go out and buy a car, that they would not buy a car from the exact first place they went to without even questioning and comparing it to other prices or whatever they do, internet searches or whatever. And I think what we need to do is look at the cost of healthcare, but more importantly, look at the outcomes. Okay? So why is it that a certain hospital system is charging much more for a hip replacement? Is it because they're better or just because they charge more? If they charge more, but their outcomes are better, then it's justifiable. So we have to have a two-pronged approach and look at compare costs for elective services, of course, because for emergency, you know, you got to obviously go where it's the closest emergency facility. But more importantly, let's look at outcomes, and those are things we need to work on still.
And there's such a disparity between how much services cost in this country, in the state, versus other states and other countries, too.
Right.
So, I know we have given folks so much here, a big plate full of information. People are going to definitely have a lot more questions, and I know there's a whole list of places that people can go to. You want to throw out a few websites and a few resources for people if they're interested?
And I think it's going to be on your screen, because I
Yes,
don't
it
know
is.
them all by order, but you can contact my office, you can contact Covered California, the California Benefit Exchange, Department of Healthcare Services, California Health Coverage Guide, Small Business Majority, Health Law Guide to Businesses, and Take Action California. And again, as I mentioned, it's not here, but feel free to always contact our office. Anyone who lives in the 24 Senate District, we are here to serve you. Call us for anything. We'll help you through the process. If you're a small business, we will help you. Our goal is to make sure it's successful, but more importantly is to serve you and anybody in the state of California. Call our office, and we'll be willing to help you.
Definitely the goal is to make it successful, but we have only just begun. Where do you see this 5 years out? When will we start to see this whole thing really take shape and affect Californians?
Well, there's going to be some bumps. No ifs, ands, or buts. But we will work through those bumps. In 5 years, you're going to start. It's going to be like a snowball effect, and it's going to get bigger and bigger. And then I hope in my lifetime, 20 years from now, that we're going to look back and say, what was this ACA? I mean, this is like, you know, second, everybody has it. It's something that we expect. It's right. It's the right thing to do. And people are actually getting coverage in healthcare. But more importantly, people are going to live longer, and it's going to be much better for our country and our state.
And I suppose what will help here is education, that obligation, if you will, that you as a physician and your colleagues and you yourself as a lawmaker, a lot of education. Covered California has got that obligation too, to educate the public on what is going to happen within the next year or so.
Definitely. Definitely.
And I suppose the other way to look at it, despite all of the rhetoric that we've heard over the last couple of years and the concerns about socialized medicine and the death panels, I know you've heard, to some degree, maybe the folks that sort of preached that actually did the country and the state a service, because we've sort of underestimated this so much that it's actually going to work out better than what we think, right?
Well, I think at the end of the day, the consumer and the electorate get it. And once they realize and are realizing now what they're going to be offered, they're not going to want to go back. And we're going to move forward, and the pundits will just keep talking, and we'll just hopefully get this going and move in the right direction.
Am I exaggerating if I say it could be life-saving?
It definitely can, because some of those individuals that wrote questions in who had these high expenses, and they're going to actually get reduced cost, they're going to get better coverage, they're not going to be denied, and it will be life-saving for them and their families.
Great. Well, this is definitely a work in progress. I hope to have you back again in some other format and venue where we can discuss this further as the implementation of the Affordable Care Act in California rolls along. So thank you very much for your information and your time.
Thank you. It was a pleasure being here, and I really enjoy being here at the show.
Great. We appreciate your advice and your education. That does it here for this program on California's implementation of the Affordable Health Care Act. Our guest has been State Senator Dr. Ed Hernandez. He is a practicing optometrist. He is also chair of the Senate Health Committee. And we do encourage folks to watch again. This program will be archived on this website, on this page. So check back here again if you have folks that you would like to, friends or family, if you'd like to watch this. Definitely some education and edification here to share with friends and family and other folks who have questions about the Affordable Care Act. But for now, that does it for this program. Thank you very much, Senator. From the state capitol here in Sacramento, I'm Brian Green. Thanks for watching.